Hello, and welcome to Miami-Dade College's Center for Community Involvement. If you're viewing this video, you've decided to participate in the partnership between Miami-Dade College and Miami-Dade Area Health Education Centers, also known as AHEC, in their Tobacco Prevention and Cessation Program. What you'll be seeing is the video on prevention entitled, "They're Rich, You're Dead." The They're Rich, You're Dead program was created by Dr. Arthur Pechenik, a local pulmonologist at the VA hospital. He is also a professor at the University of Miami School of Medicine. So let's get started. By now you should have your script with you. What Dr. Arthur Pechenik has done has created a script to go along with the video, so it's a lot easier for our health profession students to go through. Everything you need is in this script. So let's get started. First, if you decide to do this program, what you'll need to do is work with your CCI, Center for Community Involvement staff member, on setting up a date for you to present. The presentation is on session 1. If you noticed in your handout, session 1 and there's also a session 2. Miami-Dade College students are only conducting session 1, which is 60 minutes. The difference is session 2 is 90 minutes and also includes having a real-life patient who is suffering from various diseases caused by smoking sit there with the youth that they're presenting to for a question and answer period. You will only have session 1. What you'll need to do is show up in your Miami-Dade College uniform or scrubs or t-shirt 30 minutes prior to when you're scheduled to present so that you'll have an opportunity to set up and familiarize yourself with the AV equipment. And then when you have your audience, essentially you would state the aims, which are here. You'd introduce yourself and then you'd state the aims. We're here to show you what is seen in our hospitals every day as a result of smoking, explain how smoking causes these diseases, and explain the risk of them actually happening to you if you choose to smoke. We're also going to show you how smoking harms you right now while you're still a teenager. And lastly, we're going to answer any questions you may have. And at that point, that is when you drop down at the bottom of your script and you would basically state what is in bold. You'd state, surveys show that the great majority of teenagers worldwide are tobacco-free and prefer to date non-smokers. And at that point, you would show the first minute of the video. This is the main menu of the If They're Rich, You're Dead video. You're going to show the first minute of music videos. And you'll also point the I Don't Smoke, which is the first minute.
This video is dedicated to the millions of kids who will be doomed to an early, painful, and needless death when they make the decision to smoke.
Care for a smoke?
I don't smoke. I don't smoke. I don't smoke. Why should you?
Care for a smoke?
Ja.
Majha.
Nej.
Nej. Ej.
Le.
No. Yeah. 不要
Jak się to
No. No.
Vietnam. Nah.
No.
La.
No way.
I don't smoke.
At this point, you would pause it at the introductory sign that says Confessions of a Teenage Smoker and go back to the bottom of your script and read what it says in bold, which is, let's see why the great majority of teenagers choose to be tobacco-free, why they choose to date non-smokers, why this is becoming a trend, and why more and more the teenage smoker is becoming the odd man out. At this point, you would continue playing Confessions of Teenage Smokers, which is about 8 minutes.
I didn't know that it was addicting, but it is.
I thought I could just one day just quit.
When you found out?
That it ain't that easy.
A cigarette, you know, I have to have one. I have to have one. It's very embarrassing for me.
You're addicted.
I'm addicted. I used to trick myself and say, you know, hey, I'll never get addicted. All my friends, no, I'll never get addicted, but just like that.
Did you think, hey, I can quit anytime I want?
Yeah, I probably could, but you can't.
Up there, that's where the cancer is coming back. And that's caused from cigarettes. This PSA is brought to you by NSPC, Night Shift Party Cartel, Snake Eyes, #1 with the prize, 9 Yard Blitz featuring Trip, Dr. Pachenik, and Black Knight Recordings. Now let us proceed.
Yeah. You thinking about smoking cigarettes? Don't do it. Who that keep wrecking their lungs? You acting real messed up. Don't you know that when you smoke on them cigarettes, you live a short life?
I started out when I was 10 with all my friends behind the school. We broke every rule cause we thought it was cool. We blazed up, rag, gag, coughed and wheezed. But who'd have figured that our lungs were becoming diseased? What kind of fools were we? Cool fools. Just say no, it's kinda hard to resist. With my partner saying go, go where, nowhere, nightmare. There's cancer everywhere. Plague my respiratory, chemo taking all my hair. For many years I tried to quit, couldn't quit. Now that's it, I'm dead just like they said. Just like I read. I remember living as a whole.
That's right.
Now it's silence for the dead, eternal peace for my soul. And I have cancer of the tongue. There's something growing in my lungs that bleeds and causes pain. They cut a hole into my throat, from which I breathe, gas, rasp, and choke. I fight for each and every single breath, and I puff myself to death.
I say do that, keep wrecking their lungs. If you do that, you act the dumb. Cause when you smoking and choking on a cigarette, you live a short life. And this shit could bet, so go on and smoke your life away. Or go on and smoke your life away. Or go on and say smoke your life away. You ain't cool. Or go on and smoke your life away. Stupid. 6 million ways to die, choose one. 6 million ways to die, choose one. Take a long pull and sing. Murder was the case that they gave.
But still I'll smoke and let you catch the contact. Secondhand cancer, lungs tar, sticky black, off in the scene. My clothes reek of nicotine, breath smells bad, yellow teeth, and I feel like a fiend. This cancer got a hold of me. Tobacco take control of me, and the cell it won't let go of me. I tried to quit, but puffing is so gratifying. To me, those cancer sticks be like satisfying. I never figured cigarettes could ever hurt me.
That's a lie.
I died early, quick, cold turkey. I fought for each and every single breath, and I puff myself to death.
I said who that, keep wrecking their lungs. If you do that, you acting dumb. Cause when you smoking and choking on them cigarettes, you live a short life. And this you can bet, so go on and smoke your life away. Or go on and smoke your life away. Or go on and say smoke your life away. You ain't cool. Or go on and smoke your life away. Stupid.
It's like being trapped in a box of cigarettes, but you can't get out, cause that nicotine be calling you. I'm the one that causes death. Getting you addicted is all just a game to me. I call your name by the boxes every day. I got you, you can't seem to stay away. Yeah, my name is nicotine. I infest your body with cancer. I've caused more deaths than AIDS, alcohol, and drunk driving combined. How many they kill? Ain't got nothing on me. See, you got two choices. Your first choice, if you choose to live, you can stop smoking cigarettes. Choice number 2, if you wanna die, just keep smoking me away. Your wish is my command.
Tell them. 6 million ways to die, choose one. 6 million ways to die. 6 million ways to die, choose one. 6 million ways to die. 6 million ways to die, choose one. 6 million ways to die, choose one.
Look, it's this simple. If you puff and you smoke, you die.
Fact: the vast majority of long-term smokers start before the age of 20. 50% will die an ugly and early death directly because of it.
I can't go without having cigarettes. You know, I don't have that control over myself, and I really wish I did.
I don't think I could go 3 hours without a cigarette. I would leave school, risk getting suspended, risk getting fined just to smoke a cigarette. That's how addicted I was.
Everybody that smokes cigarettes probably wants to quit, but they can't because it's just like a drug.
After about 4 hours of not having a cigarette, that's all that's on my mind, and I'm trying to say no, stop, you know, like no.
you cannot smoke anymore, but the cigarettes say yes and I say no, and they keep coming in. And
people say that it's easy to quit. It's not easy to quit. You know, I've been smoking for a long time, and every so often I'll be like, yeah, I'm gonna stop smoking cigarettes, but I can't.
It's terrible. And like, if you really think about it, I'm just killing myself. You know, like, it's just a slow, painful way of killing myself.
I'm probably gonna smoke till I die.
Yeah, this girl, Sarah, I asked her out and she said, but you're a smoker, and that was her answer. But you're a smoker was her answer.
My last boyfriend, he kind of broke up with me because he didn't like how I always smelled like cigarettes, how my breath always smelled, you know.
I used to play soccer, but because of the smoking, I wasn't able to keep up with the rest of the team. I tried for a little while and I got cut, so that was the end of my soccer career.
Cigarettes started catching up to me. Like, I'd be running up the court and all of a sudden I'd have to get out because I don't have any more breath.
I seemed to get tired every time I ran. I got slower in everything I've done.
Yeah. How am I going to be a gym teacher when I'm smoking, man? I can't open up a pack of cigarettes and be like, yeah, kick the ball a little harder, little Billy, and you'll get it in the goal. You don't have to smoke to be cool. You know, people might be like, oh, haha, they don't smoke. But when you get in high school, they're going to be the ones that are saying, oh, I wish I had never started. Because they're going to be the ones that don't make varsity baseball or football or whatever when they try out.
It's really hard to play sports when you smoke.
I wake up coughing and hacking, phlegm comes up and stuff. It's nasty. Even during the day, you hack and cough and spit up.
My lungs must look like a prehistoric ancient mosh pit of tar. Don't smoke. Smoking's terrible. I wish I would have never started.
At this point, you would pause the video and go back to the main menu. And when you go back to the main menu, what you do is continue reading what is listed in your script at the bottom of page 1 leading into page 2, which basically states these teenagers that you just saw in the video already suffer from very serious problems from their smoking. As you saw, they were all severely addicted to nicotine. They wanted to quit smoking, but they couldn't. They also had very serious problems with dating, physical fitness, their athletic ability, and their health. And it is well known that teen and preteen smokers already have, and then you'd state what's listed on your script. Number 1, major nicotine addiction, decreased growth and development of their lungs, black lungs, bronchitis, cough and phlegm production, increased respiratory infections and increased risk for asthma, decreased physical fitness and their decreased athletic ability, like the young people in the video, increased blood carbon monoxide, which also reduces the oxygen supply to the heart, blood fat abnormalities, and early hardening of their coronary arteries, which lead to later heart attacks. And perhaps most frightening of all, precancerous mutations in their lung cells, which can later lead to cancer. At that point, you would go ahead and drop down to the other section, which is in your video, in your script, which states, these teenage smokers that you just saw in the video are therefore strongly predisposed to one or more of the life-threatening diseases which you are about to see in our patients. This is what they have to look forward to in their future. And at that point, that is when you would you'd go back to the main menu and you'd play the science portion of the video. This is where you'd go back to the main menu and you would play the science video. When you go down to the science video and hit play, you'll see that there's various titles. All you're going to do is press play so it can run through the entire video, which is 24 minutes in total. If you're running short on time, Dr. Pechenik states in your script that you can actually stop the video after heart disease and then continue on with your question and answer period with the youth that you're presenting to. However, we're going to show it in its entirety and then move forward.
In video 2, we review the case histories of each patient seen briefly in video 1, their disease and how smoking caused it.
Surgeon General's warning. Smoking causes mouth cancer, throat cancer, lung cancer.
Don't wait, don't wait. Don't cigarettes away.
That was Mr. Willie Thornton trying to speak after his tongue was removed. After years of smoking, he noticed an enlarging growth on the back of his tongue which interfered with swallowing and breathing. A biopsy of the growth proved that it was cancer. To remove the cancer, which was blocking his airway, most of his tongue had to be removed and a surgical hole placed in his neck to allow him to breathe. The surgical hole in his neck is called a tracheostomy and is seen here. Despite surgical treatment, the cancer spread to Mr. Thornton's neck, as seen here. He received radiation treatment for these cancerous lumps in his neck, but died anyway shortly thereafter.
Look what happened to me. It could happen to you.
This patient had a cancer of the mouth which spread up into his nose, sinuses, and eye. In order to remove this cancer, half of his face had to be removed surgically. His wife pointed to his face and said,
Up there, that's where the cancer is coming back. And that's caused from cigarettes.
Amazingly, the patient could still speak, and when asked, "Did you think you could quit anytime you want?" he answered,
Yeah, I probably could, but you can't.
This is a patient with cancer of the lip from smoking. You can see the cancer progressively invading his lip and face. This is Mr. Jerome Brown. After years of smoking, he noticed a change in his voice and increasing hoarseness. This led to a laryngoscopy. In this procedure, a slender tube with a light at the end called a laryngoscope, seen here, is passed through the nose and into the throat to the level of the vocal cords. Normal vocal cords, as seen through the laryngoscope, are shown here. Inspection of Mr. Brown's vocal cords revealed a large whitish cancer as seen on the right. To remove this cancer, Mr. Brown's entire larynx or voice box containing his vocal cords had to be surgically removed. This operation is called a laryngectomy. As Mr. Brown's doctor stated,
he is now 1 week out from surgery, and you can see that he now has his windpipe brought right out to the skin as a tracheostomy. He will breathe through this hole in his neck for the rest of his life.
This was necessary because the airway between his mouth and his windpipe has been surgically closed off to prevent him from choking when he swallows food or fluids, something the larynx, which was removed, normally prevents.
He will be able to eat and drink fairly normally, but he will never be able to speak or use his voice in a normal fashion.
Although he can't speak, Mr. Brown wrote a handwritten message for teenagers which reads, "Think, don't smoke." This is Mr. Gregorio Flores. He also developed cancer of the larynx from smoking and required a tracheostomy, a surgically placed breathing hole in his neck. Despite this surgery, he continued to smoke. He inhales the smoke through his mouth and then blows it out through the hole in his neck. Because of his severe addiction to nicotine, he continued to smoke this way right up until his death. He died from inoperable, widespread throat cancer a few months after appearing in this video. At the age of 32, Mr. Calvin Dorset also developed cancer of the larynx from smoking, which required a laryngectomy, a surgical removal of the voice box, and a tracheostomy, a surgically placed hole in his neck. Following the surgery, he also couldn't speak, but eventually trained himself to speak by using an electronic device, which, as you can see, he places in his mouth. Speaking through this device, he said,
"I was diagnosed with cancer of the larynx. I had a tracheotomy from mom, and at that time, I quit smoking. Don't go through what I went through. The easiest way to avoid what I'm going through is not to smoke at all."
This is Mr. Claude Levy.
I've developed a tumor on top of my lung, and it seems that it came out of my lung. And it's in a spot that is very dangerous because they can't see it too well. And I should be operated on it. But right now it's a lung problem that I have.
After years of smoking and feeling well, Mr. Levy suddenly coughed up streaks of blood. This led his doctor to get a chest x-ray which showed a large cancer in his right upper lung. And this is the cancer, the white, rounded mass the size of a small baseball. This led to a bronchoscopy. During a bronchoscopy, a slender tube with a small light at the end of it, called a bronchoscope, seen here, is passed through the nose all the way down to the lungs where the cancer can be seen and biopsied. Here you see Mr. Levy undergoing a bronchoscopy. The bronchoscope is being passed through his nose into his lower throat to the level of the vocal cords. Then, through the vocal cords, into the windpipe or trachea, and then down to the right and left main bronchi, which lead to the right and left lungs. At this level, you can see a large cancer which is bleeding and almost completely plugging the right main bronchus. Here you see a biopsy forceps pinching off a piece of the cancer to prove the diagnosis. The diagnosis of lung cancer was proven, but by this time the cancer had spread and couldn't be removed by surgery. Mr. Levy therefore received treatment with radiation in an attempt to burn away the cancer, and chemotherapy in an attempt to poison the cancer with drugs. These treatments failed to control his cancer and also caused many toxic side effects, including total hair loss and recurrent nausea and vomiting. He died shortly thereafter. At autopsy, Mr. Levy's lungs looked like this. They were stained black from cigarette tars, and a large whitish cancer was seen in the upper lung field. A few weeks before he died, Mr. Levy asked if he could leave a message for kids who have started to smoke.
I started smoking when I was about 15 years old. A friend of mine gave me a couple cigarettes, and that's how it all started. It's very hard to quit. I suppose we get addicted to the nicotine, and there's some psychological involvement also in it, so it's very, very hard to quit. If you did start, do your utmost to stop now, because later on it's going to be extremely hard to do.
How did smoking cause the mouth, throat, and lung cancers of these patients? 1. Harmful chemicals in tobacco smoke repeatedly damage cells in the mouth, throat, and lungs. 2. In time, a few damaged cells reprogram their DNA and genetically mutate to cancer cells. 3. Unlike normal cells, cancer cells grow without control, invading and destroying more and more surrounding tissue. 4. Cancer cells can also break away from the original tumor and travel through the body to form new tumors in distant sites, such as the brain, bone, and liver. This is called metastasis.
Surgeon General's warning: smoking causes emphysema.
This is Mr. Taj Breadwell receiving oxygen by face mask.
I do have emphysema, which comes from smoking. I found it extremely hard to stop to where it became almost impossible. How far I can walk without getting shortness of breath? About 15 to 20 feet. Now I have to be on oxygen all the time.
This is Mr. Richard Heath receiving oxygen by nasal prongs.
It all started with smoking a cigarette when I was 12 years old. If I walk 10 or 15 feet, I'm out of breath. If I walk from my chair in the living room to the toilet in my bathroom, in my bedroom, it's maybe 20, 25 feet. Steps, 25 steps. And then I'm really exhausted.
You can also consider pausing at the end of emphysema section. Now what happens here is that there are 2 exercises that you can choose to do. One of 2. What Dr. Pechenik suggests One, asking everyone in the audience to participate by, if you look in your script, it says there's an exercise for emphysema. Essentially what you want to do is ask your audience so that they can relate to the patients who have emphysema to blow out all of the air that's in their chest. So essentially they go, and after they've blown out everything, exhaled all the air in their lungs, at that point you'd ask them to hold their nose and to hold their breath. And at that point, you'd see who can hold their breath for 30 seconds or more. Now, most people will tend to breathe in and then hold their breath. You have to make sure that they're not doing that. You have to ask them to push out all the air and then close their nose and hold their breath for 30 seconds. And what that does is let the audience really feel how an emphysema patient feels all the time. So after they try to hold it for 30 seconds, you say, this is how end-stage emphysema patients feel all the time. That's one exercise. The other exercise is consider having a couple of straws. And what I do is normally with the younger crowd, anywhere from 5th grade all the way through middle school, I ask a couple of people to come up to participate in the demonstration. You give them each straws, of course enclosed. You ask them to open it. And then at that point, you'd ask them to put the straw in their mouth. And when they put the straw in their mouth, you ask them to hold their nose and only breathe through the straw, like this. And at that point, when they're closing their nose and breathing in and out only through the straw, you ask them after a couple of seconds, how was that? How hard was that? And usually it's pretty tough. And at that point you would say, this is how the end-stage emphysema patients feel all the time, just walking from here to maybe over there, from their bedroom to the bathroom. Very simple things that we sometimes take for granted. So that's one exercise you can do, and then you'd continue on to the rest of the video.
Surgeon General's warning: smoking causes heart disease.
This is Mr. Jerome Brown. After years of smoking, he developed pressure-like chest pain which radiated down his left arm and occurred each time he walked a few blocks. His doctor suspected that the chest pain originated in his heart and ordered a coronary angiogram. A coronary angiogram is an X-ray which shows the blood supply to the heart. A normal coronary angiogram is shown on the left. Mr. Brown's coronary angiogram looked like the one on the right and showed a critically blocked coronary artery, seen at the arrow. How did smoking cause this problem, and how did it cause Mr. Brown's chest pain? 1. Harmful chemicals in tobacco smoke damage the lining of arteries so that less blood gets to the heart, as shown at the arrow. 2. Smoking adds carbon monoxide to the blood, which reduces the oxygen supply to the heart. 3. Smoking makes the heart work harder by making it beat faster and against a higher blood pressure. When Mr. Brown's heart was forced to work harder while receiving less blood and less oxygen because of his smoking, his heart became damaged and produced his chest pain. Despite medication, Mr. Brown's chest pain became more severe, more frequent, occurring even at rest, and required coronary bypass surgery for relief. During the coronary bypass surgery, Mr. Brown's chest was surgically opened, his heart was exposed, and the blocked coronary artery was bypassed with a vein taken from his leg. This increased the blood and oxygen supply to his heart muscle, and fortunately relieved his chest pain. Unfortunately, smoking also decreased the supply of blood and oxygen to Mr. Brown's feet by causing peripheral vascular disease. This resulted in gangrene in several of his toes that had to be amputated. So this poor man had 3 very serious illnesses, all of which came from smoking. 1. Cancer of the larynx, which required a laryngectomy and tracheostomy, as seen in the upper panel. 2. Blockage of the blood and oxygen supply to his heart, which caused angina pectoris, heart pain, and required coronary bypass, open heart surgery, middle panel. And 3, blockage of the blood and oxygen supply to his feet, causing gangrene of his toes, which required amputation, lower panel. All of this could have been avoided if Jerome Brown never lit that first cigarette. As his physician stated,
He's been through a lot and is still hanging in there, but you don't want to be put in this position.
Surgeon General's warning: smoking may complicate pregnancy.
This baby was born premature, weighed only 2 pounds at birth, and was in acute respiratory distress. This baby's death may well have been avoided if the mother hadn't smoked during her pregnancy. The baby inside of a pregnant woman who smokes receives all of the poisons from the cigarettes, including carbon monoxide. This causes prematurity and respiratory defects as seen here.
My name is Willie Mae. I started smoking at the age of 15. I became pregnant at the age of 15. I smoked during my pregnancy. My baby was born with asthma, respiratory, breathing problems, and he's very sick.
My name is Valerie. I started smoking at the age of 13. I had previous miscarriages. I don't know if it's from the smoking. I have a small premature baby that did make it. He had breathing problems. He breathed like he has asthma. He was born at 2 pounds and 4 ounces. He was a very small baby, which they tells you on this pack of cigarettes it can cause premature babies from smoking or even death. And so far it is true.
Warning: smoking ages the face, and smoking stains the teeth and hands.
In this slide, facial photographs of non-smokers are compared with those of regular smokers of the same age. The smokers on the right can be easily picked out because their faces are much more wrinkled. Smokers' face has been well described in the medical literature. Smokers in the 40 to 49 year age group were as likely to prominently wrinkle as non-smokers who were 20 years older. Tobacco tars stain your teeth and hands black, as seen here. In the same way, but much worse because the smoke is inhaled, tobacco tars stain your lungs black. In this slide, the lungs of a smoker are compared to the lungs of a non-smoker. These are casts of real specimens. The lungs of the non-smoker have a normal pink color, left panel. As you can see, the lungs of the smoker are stained black from inhaling the tars and tobacco smoke, middle panel. These are the very same black, oily tobacco tars that cause cancer, chronic bronchitis, and emphysema, as seen in the far right panel. This is a normal cleansing tissue. It represents clean lungs. In this experiment, smoke from a single Marlboro cigarette was blown forcefully through this tissue. Even though the cigarette had a filter, you can see how much tar got through to stain the tissue brownish black. This large amount of stain came from only one filter-tipped cigarette. Imagine how black your lungs get after smoking hundreds of cigarettes. If you're thinking about smoking, try this experiment and see for yourself.
What problems does smoking cause teenagers?
At first I enjoyed smoking. I loved the feeling of, you know, I'm cool, I'm a man, but it's not like that. I wake up and I can't help myself but to smoke. I've tried quitting many times. It hurts to stop. I'm addicted. I used to trick myself and say, you know, hey, I'll never get addicted. All my friends know I'll never get addicted, but just like that, the more you trick yourself, the worse it's going to be. It's embarrassing, actually, to me, to have to, you know, depend on a cigarette. You know, I have to have one. I have to have one. It's very embarrassing for me. When I'm with people that don't smoke, I feel like, you know, I have to separate myself from the group in order to have a cigarette. And it's like I said, it's embarrassing. A lot of girls do not like the smell of cigarettes, do not enjoy, you know, being around people that smoke.
Jay Taylor is a 19-year-old smoker who started smoking when he was 16 years of age. After only 3 years of smoking, pulmonary function testing of his small airways at the University of Miami Medical Center revealed that he already has the lungs of a 66-year-old non-smoking man. Jay already has difficulty participating in competitive sports with his current lung function. If he continues to smoke, he's clearly heading towards disabling emphysema and chronic bronchitis with shortness of breath at rest and the need for continuous oxygen.
Every time I light up a cigarette, I think about, you know, maybe in 30 years, you know, I'm gonna, you know, die of lung cancer, you know, have a a tube in my throat, and it scares me, and I still smoke.
You still smoke?
That's what scares me the most.
For smoking cessation information and or information on referral to a smoking cessation clinic in your area, call 1-800-4-CANCER or call the American Lung Association, Heart Association, or Cancer Society. Cancer is a growth that invades tissue without control and has a tendency to spread to new sites. Emphysema is a pulmonary condition characterized by overdistension and destruction of the air sacs in the lungs. Chronic bronchitis is prolonged inflammation of the bronchi characterized by attacks of coughing up mucus. Coronary heart disease is a condition, such as arteriosclerosis or hardening of the arteries, that reduces the blood flow through the coronary arteries to the heart muscle. All of this suffering and early death could have been avoided if these people never lit that first cigarette.
At this point, this is where you end the video, and you would continue in your script where you would give a few demonstrations before you get into your question and answer period. So refer back to your script at this point. At the end of the science video, it basically states that you should demonstrate a tar-stained handkerchief. This is the tar-stained handkerchief that your CCI staff member should have. Now, there may not be enough to go around because they may be checked out for other presentations, but you'd also have a copy of this tar-stained handkerchief in your script. If you turn to page 7, after page 7, you will see a copy of the tar-stained handkerchief. Now, essentially, you would hold this up and say, this is the tar from the smoke of only 2 Marlboro cigarettes blown forcefully through a clean handkerchief, and this is what you inhale. This is the same tar that contains poisonous chemicals which cause mouth, throat, lung cancer, and also chronic bronchitis, emphysema, black lung, heart attacks, and strokes. If you smoke or you know someone who smokes, try this experiment, have them try this experiment so they can see for themselves. You can pass this message on and maybe save a life. Now, you also have in your script, right behind the tar-stained handkerchief, you actually have a copy of a tar-stained handkerchief from marijuana. This is actually from blowing the smoke of 2 marijuana blunts into a clean white handkerchief. And as you notice, there's actually more tar inside of this particular handkerchief. And that is because marijuana actually has more carbon monoxide and more tar than cigarettes. It just does not have nicotine, which is the addictive factor. Marijuana is habit forming, however, it is not addictive. The nicotine in cigarettes is addictive. After you've pointed this out to your audience, you refer back to your script in the same area, and you continue on and discuss secondhand smoke. Essentially, you'd state another major point is breathing other people's smoke, which is commonly called secondhand smoke. It is also called environmental smoke. Over a prolonged period of time, this can also cause the very same health problems that you saw from the people in the video. This is another strong reason why the great majority of teenagers prefer to be tobacco-free and prefer to date non-smokers. Just so you know, secondhand smoke, we tend to call it a double homicide. When you inhale, you're killing yourself. When you exhale, you're killing someone else. One of the things that you have to point out while you're conducting your presentation, the audience will have a script, a handout, excuse me. The handout they'll have is going to be given to you by your CCI staff member. And the handout is also included in your script, so you're aware of what your audience has. So pages 7 through 10 in your script are essentially the only pieces that the audience will have, the youth will have. So when you are conducting your presentation, you're going to be saying things about part A, part B, part C, and part D. Those parts are actually in their handout. So if you go back to page 2, where you were discussing the tar-stained handkerchief, essentially you can tell them the video we just saw and the tar stained handkerchief experiment, you can, it's also listed in Part A of their handout. They have a copy of the tar stained handkerchief in their handout. Now on page 3 of your handout, you go on to say, Part B of your handout lists free community resources on helping a person to quit smoking. Part C of your handout provides information on how to view or obtain copies of the video that you just saw if you want to show it to others. And Part D of your handout lists classroom exercises on improving tobacco resistance skills. We'd like you to think about these as homework. Your teacher may be willing to assign this as formal homework, maybe not. And then at that point, you would open it up for questions and answers. And Part A, B, C, and D of their handout is actually listed in your handout as well. Now, on page 3 of your handout, you're going to see that there is session 2 listing. You can essentially draw an X through that section because that section, you're not going to be doing session 2 as I mentioned before. So session 2, go ahead and draw a big X through that on page 3. And also on page 4, that's the continuation of session 2. Draw a big X through that so you do not confuse yourself. Now on page 5, it says preparation. This is essentially what you need to do to get yourself prepared for leading up to your presentation. If you've decided to participate in this program, what you'll need to do is contact your CCI representative and they will give you a DVD, the DVD of They're Rich, You're Dead. They will also give you a binder. Now the binder has questions and answers. Now the questions are from the frequently asked questions over the years that Dr. Pieczenik has received after students have viewed this video. Some of them are listed in Part D on page 5. If you notice, there are actually questions there, and then next to it in parentheses, there's a page number. That page number corresponds with the binder that your CCI representative will give you, and you can go there and find the answer to that question. There's a short answer, and there's also a long answer, so you have a bit more of the history behind that. Please make sure that you prepare yourselves prior to going out to these presentations. The children are usually very curious and they also have a lot of information, some of it true, some of it false, but we don't want to give out any false information. One of the things that I encourage you to do is make sure that you review the binder and then also make sure that you review handouts that will be within your binder. The CCI representative should be giving you a handout on cigarettes and some of the cancer-causing agents in that. Also, what happens to your body once you decide to quit. There's also information with a pamphlet on a hookah, which is a new trend in smoking in the United States, and also on marijuana. And in the Part 2 of this video, we'll go into more detail on that. So on page 6, what I want you to see is that that's a continuation of the presentation suggestions. Again, make sure you show up 30 minutes prior to your scheduled time to present and that you are wearing your Miami-Dade College uniform, scrubs, or a t-shirt. You are now a representative of Miami-Dade College. You will also be graded on your conduct as well as your presentation. So we know you'll do a good job. This particular presentation is really fun, it's creative, and you can also add some of your own information to this. And information in terms of your experience. If you happen to be a smoker, if you're an ex-smoker, if you have family members, friends, or even some patients who are smokers, you can give some of that information on how people are dealing with their situation or how tough it is for them to quit. Share that information with the group so that they can relate. I'm sure they have either parents who are smokers, grandparents, or some other loved ones. Now, if you decide to implement any type of handout that you may have seen when you're doing your own research, you must have it approved prior to your presentation by a CCI staff member. It is required that you do not add any other handouts to this presentation unless you receive prior approval. Other than that, I say good luck, and please view video 2, part 2, and you'll be able to see how you set up your props that we send you out with. We have a number of props, including pig lungs, real pig lungs, a tar jar, a replica of the teeth and how they are affected from smoking, and some other quite interesting things. Thank you, and I look forward to your presentation.